And to that end, we've continued the mobilization that began at President Trump's direction early this year. We increased testing from a standing start in the month of February to now. As of today, we've completed more than 170 million tests. We continue to approve new tests, including an at-home test that the FDA just recently approved, and we're distributing more than 150 million Binax tests to schools and nursing homes around America as we speak. Our mobilization of supplies, you will hear described in great detail, continues to surge each and every day. We actually are able to track PPE and supplies on a hospital-by-hospital basis. And so we're carefully monitoring, we're working with state officials, with hospital administrators to make sure that our hospitals have the support they need. Also, as we gather, more than 140 clinical trials for therapeutics continue to be underway, but effective therapies are already available. They're widely known among the American people. For those over the age of 70, we're proud to report that we actually have decreased the fatality rate by more than 70% since those heartbreaking days of April. In May of this year, of course, as the President spoke last week in the Rose Garden, we launched Operation Warp Speed, focusing on accelerating the development, the manufacture, and the distribution of a safe and effective vaccine. And you'll have an update today on the progress from two of our leading experts and those that are coordinating Operation Warp Speed. What I want to say in the midst of all of this to the American people as we begin this briefing is that with the massive increase in testing over the last 10 months, with PPE and medical supplies and equipment that are available to the American people, with the medicines and the therapeutics, and very soon the vaccines that are available, America has never been more prepared to combat this virus than we are today. But our pledge to each and every American looking on today is we're going to work around the clock to keep it that way. We're going to make sure that hospitals that are seeing patients coming in on an increasing basis know that we're going to work around the clock to meet that need. And you have our continuing pledge and the practice of experience that we've had along the way. So in a few moments, you'll hear from members of our team. We're going to begin with Dr.
Could be more supportive. And this is really a call to action for every American to increase their vigilance because of the graphic that is shown here. Wanted to show you the difference in slopes between the spring surge, the summer surge, and the fall surge. So the American people know that this is more cases more rapidly than what we had seen before. But to also make it clear, like before, we do know what to do. And we're asking every American to do those things today. The next slide shows our increase in test positivity. The light brown bars are the number of tests that were performed, but even with the number and ever increasing number of tests performed, you can see the increase in test positivity to around 10%. In some areas of the country, it is much higher than that, and it illustrates the ongoing community spread in your counties, in your small and large metros, and in your rural areas. The next slide really shows the country as a whole and why we're asking every American to remain vigilant, to do those things that we have been asking you all to do, to wear a mask, to physically distance, to continue your hand hygiene, but really in this moment of bringing people together, to really limit interactions indoors to immediate households when we see this level of community spread. Behind this level of community spread is a lot of asymptomatic cases. People are spreading the virus because they don't know they're infected with the virus. And so people are coming together indoors. Everyone looks healthy, but among those individuals could be individuals that already are infected, have no symptoms, and are unknowingly spreading the virus to others. It is because of this asymptomatic spread that we have asked people to wear masks indoors and to ask people to wear masks when among others. But sometimes when we go indoors and we're with friends and family, we just assume that if you look okay, you are okay. And now we know that over 50% of the individuals, particularly among those under 35, many could be infected and unknowingly spreading the virus. This virus increased so rapidly because there was an unusual cold snap that began in the northern